Hi there, welcome to Mental Health Tips from Sun Valley Behavioral. I'm Dr. Bernardo Ng, psychiatrist and medical director of Sun Valley Behavioral Medical Center. I'm so happy that you're listening. I'm going to talk to you about a topic which is very important and has gained a lot of attention because of how much it affects your life and how easy is it to fix it. Okay, so here we go. The topic we're going to talk about today is sedentary lifestyle. Okay, we'll start with the definition. Sedentary, it speaks from the medical point of view, people who spend less than 10% of their time awake moving around, walking, going upstairs, going downstairs, going around the house, walking in the mall, or walking around your office. And when this happens, which by the way, statistics show that 80% of Americans are sedentary. Can you believe that? It's a lot. If you think about it, it's true. Think about the first 10 people that come to your mind. Well, 8 of them are sedentary, aren't they? Yes, I'm telling you. So sedentary lifestyle, or sedentarism, which is sort of a hard word to pronounce, speak about that habit that many of us have where we just sit down, lay around, be on the horizontal position most of the day. Well, it's not good. It turns out that it uses some muscles, and a lot of muscles are not used when you remain sedentary for long periods of time, day after day. And what happens with those muscles? It turns out that they don't rest, they don't get relaxed, they actually get inflamed. And once they start to get inflamed, they start producing chemicals. Well, by the way, the muscle is always producing chemicals. But if you're moving, the chemicals that you produce or that your muscles produce are actually very healthy, including one called BDNF, which means brain-derived neurotrophic factor, BDNF. And that's a factor that we've known about for decades that our brain produces, but also our muscles, and those are in charge of making sure that if your brain cells die, the brain can produce new brain cells, okay? So just imagine that because you're laying down all day, or rather most of the day. I know people don't like to say all day and then say, well, no, I do walk out, get out of bed and walk out of the house to the car and then get in the car and sit down again. But anyway, if you're sitting down or laying around most of the day, you're going to quit producing BDNF, which is very necessary for the production of brain cells, okay? So, besides that, when you are sedentary, you're producing bad chemicals that, among other things, they reduce the circulation and the ability of the nutrients to actually make it to the brain, all right? Once the brain starts to get inflamed because of these bad chemicals coming from the muscles, your brain starts to get depressed. And what I mean with that is that you feel depressed, you feel tired, sad, irritable, unable to enjoy things, your sleep goes out of whack, you may eat more than you're supposed to because then you're not sleeping so well, so you're awake more hours. The point is that sedentarism is now identified as a risk factor for depression. Not only that, it is also a risk factor for dementia. Okay? Dementia is that neurodegenerative disease where your brain starts to die. Would you believe that? That being sedentary can cause you to lose your cognitive abilities and your memory? Well, the news is that that's true. Okay? So, there are many studies about how sedentarism is bad and how exercising, defeating sedentarism, going against sedentarism can actually improve a lot of these things. For example, a study that they did on Australia. They checked on adolescents, how much exercise they did and how did they do in school. And then they followed them for 30 years. Okay, when they were in their 30s and 40s, they checked them again. And just think about how far into the future can your decisions today have an impact. Well, those that used to be more active in adolescence had better memory, concentration, better sleep, and better mood than the ones that didn't. So watch out. Red flag for those of you who have children that are adolescents and want to lay down all day. Another study, this one done in the United Kingdom, where they checked people who were 60s, late 50s, early 70s, for how much exercise they did. And then they tested them for their memory functions. Again, those that were sedentary scored lower than those that were physically active. Just like that, I can continue giving you examples. People that come into a clinic, and this was in the Netherlands, with depression, like the one you might have or someone in your house might have and is getting treatment now. They were giving medication, antidepressant medication, and the other group was given just a prescription for exercise. It was closely monitored, by the way. They were reminded about, this was running therapy, about running and keeping up with their exercise. Well, after 8 weeks, both groups improved about the same. Can you believe that? Without medication, your depression can improve. Wow. Of course, these were cases of mild to moderate depression. Medication also worked, okay, but exercise worked just as well. So I can continue giving you examples, but the point is, if you're sedentary and you spend most of your day laying down and only 10% or less of walking around, moving around, you're at risk of not only mental health problems, but also heart problems, lung problems, and poor health in general. So move around, okay? Thank you for listening to this tip, and see you in the next mental health tips from Sun Valley Behavioral.